So moving on, we'll move on to bruising. So she's shod in front, but she's barefoot behind, makes it easier to show bruising. So when you're looking for bruising, you're going to be normally looking around your toe area. It'll be a crescent shape, tends to be, or in your seat corn bar area, anywhere where there can be anything trapped and an excessive build-up from that. So sometimes you see tiny little pebbles stuck in the white line. That can lead to it as well. And as you pare away the sole or wherever you're working on the foot, you're going to see a reddening of the area, which is a burst of the capillary beds, and that old blood is just finally seeping through and growing through. It's not normally something life-threatening, it's not normally something completely catastrophic, but it depends on the severity of the bruising, really. And then finally we'll go on to abscesses. So when you're looking at abscesses, tends to be that a vet and a farrier can both treat them. As farriers, you do come across a lot of abscesses, especially this sort of time of year, winter. And what you'll see in abscesses is you'll see wet, dry, suppurating or septic piping corns. They all have different severities that come with them. A wet corn can be a piece of grit or gravel getting stuck between the shoe and the seat corn area, and it just rubs, gives it a bit of it just rubs a bit. A wet corn, you're going to see signs of blood. So the rubbing has done enough damage to rupture the capillary beds below in the hoof capsule, and that blood is just starting to seep through, almost like bruising in some cases I've seen. With a suppurating corn, you're going to see infection, you're going to see blood. It's going to be an open wound, and obviously a lot more serious. It needs to be treated by a vet and a farrier and an owner, all working together. And the septic piping corn is well and truly infected, and it's having negative effects on the rest of the hoof, not just the seat corn area. And finally, I'll just go over abscesses in the sense of the variations. So you've got submural. Submural work up the hoof wall and tend to burst out the coronet band. You've got subsolar, which run along the sole and tend to burst out the bulbs of the heel. You've got a gravel infection that works its way up the white line. And it can work up and down the white line, or track up and down the white line, should I say. And the final one is a suppurating corn, which I've already gone over.